The nasal naloxone or Narcan med trainer, just a little bit different in how we use this. This is all it is to give the dose. And we'll see this a lot in first aid kits or over-the-counter medications. And once in a while we'll see this with the fire department or police department that may have something like this. The big thing with training with this and with using this is to put your thumb that direction and not on the tip of it. That's what that hole is there for your thumb to fit in there. To use the trainer, verify that the patient is a possible opioid overdose by checking responsiveness. You can check pupils. A lot of times you hear snoring or slow respirations, typically 2 to 4, maybe 6 times a minute. Get your device ready, tilt the head back, insert it in the nostril until it will not go any further, and then you depress it. Take it out. I usually give it just a moment there, and then we'll turn them into the recovery position and monitor the breathing. If they don't respond to that in a few minutes, you can give a second dose if you have a second dose, or you could switch over and use a bag valve mask to ventilate them. Regardless of which you do, make sure your patient is ventilating properly.